G'day, I'm Jedynak, creator and facilitator of the internationally acclaimed and accredited Fix More Feet workshops. I help podiatrists, physios, chiros and other health practitioners master manual therapies so they can fix more feet like never before. I've had a lot of practitioners ask me for advice about improving orthotic therapy results. So I shot this video to give you the #1 best practice to improve your orthotic results. So you better stay tuned. It wasn't long after I graduated from university that I discovered orthotic therapy wasn't the silver bullet I'd been led to believe it was. Now, sure, orthotics definitely had a useful place in my toolkit, but results would often vary. Sometimes patients' problems would fully resolve with orthotic therapy. Hey, great. Sometimes patients' problems would get better, but they'd still have troubling symptoms. Sometimes the patients reported that they were better, but not best. And then sometimes, for some inexplicable reason, orthotic therapy just didn't help at all. The various symptoms still troubled the patient, and occasionally even a new symptom presented itself. Have you ever had that experience? Heck, of course you have. I know from speaking with hundreds of practitioners throughout the world that we all go through similar challenges. It's just the nature of the game. The human body is dynamic and incredibly diverse, isn't it? When we take into account body types, genetics, past medical and physical histories, geez, no wonder we have our ups and downs as health practitioners. Back in 1994, I found out about this American DPM, Harvey Lampel, who had thrown in the towel as a surgeon to teach this alternative treatment called foot mobilization. Now, I was intrigued and excited about the opportunity to learn a new skill. I secretly hoped it would solve the frustrating cases that I was worrying about. When I learned the fundamentals of foot mobilization from Harvey, I knew absolutely nothing, nada, zip, about manual therapies. I had no manual therapy training whatsoever. And you know what? A whole new world of possibilities opened up for me and my patients as a result of what I learned in that workshop. But then Harvey went and kicked the bucket, as we say in Australia, so he carked it, and I ended up very alone and isolated as I tried to develop my foot mobilization skills. So to further my comprehension of manual therapies, I enrolled in courses and seminars and workshops for physios, chiros, and now I wouldn't have been able to do this without the help of some really good mates who are willing to sneak me into various workshops incognito. Learning from other health professionals proved to be the best education I could possibly have had. Over many years, I was able to marry what I learned from the other health professions and then combine it with a podiatric understanding of biomechanics. This means I've distilled and synthesized the teachings, the research, the practical experience of physiotherapy, chiropractic, and podiatry professions into the essential need-to-know key elements that every practitioner should master. And now I can teach a very comprehensive way of utilizing foot mobilization that saves you years of learning, research, trial and errors. It's a way of treating feet that changes the paradigm of how we look at feet. It's a way of working with the body that gets incredible results. And I have to say that one of the biggest surprises I've experienced with foot mobilization is using it in a way that gets better orthotic results. Now, my teacher Harvey, may he rest in peace, he didn't say a word about foot mobilization and how it could improve my orthotic results. I reckon it took me about 3 bloody years, pardon my French, to work out how to do it consistently. Maybe it's because I'm not the sharpest tool in the shed. But anyway, at least you had the opportunity to learn exactly what to do, step by step, at a Fix More Feet workshop. Foot mobilization combined with orthotic therapy gets amazing clinical results. Even those stubborn plantar fasciitis cases, for one, become far less stressful when you systematically introduce foot mobilization into your treatment plan. Not a day goes by that I don't hear a success story from a graduate who has applied what they've learned from it. In fact, it was just last week I received a fabulous testimonial from one of my workshop graduates. Mel South, a physio in the UK, wrote this: "I can honestly say that FMT has been by far the most fun, useful and practice-changing course that I've ever done. Ted has a mountain of expertise and knowledge and he's keen to share this with his students. He has a unique teaching style which makes learning really, really fun, and by the end of it I can guarantee you will never be quite the same again. You'll come away with new knowledge, new techniques, and an increased confidence in treating foot and leg conditions. I learned so much from Ted, and I'm still learning from him years later. And his teaching and support doesn't stop once the course finishes. He's always on hand for advice and has a vast network of people who are also keen to help you with any issues, problems, or just to share it in a success story. Hand on heart, I can honestly say, if you only do one course this year, do this one. In my opinion, it's the best course out there. Like I say, the support on offer after the course is amazing, and it's nothing like I've ever found previously or since. Thank you very much, Mel, for your wonderful testimonial. It has been my absolute pleasure to serve you and your clientele. You are my inspiration. So I want to help you too improve your orthotic results by 32%. 32%? Tell me, Ted, how can you make that claim? Well, I'm glad you asked. You see, since 2002, the Foot and Leg Centre team have used the Foot Health Status Questionnaire for every case we've taken on. I think we're up to something like 16,000 completed questionnaires. The Foot Health Status Questionnaire is a great tool to quantify the subjective nature of the symptoms that patients complain of. It's been validated and passes the reliability levels that the academics demand. If you're not using this invaluable tool in your clinic, then I highly recommend you do. Just download the link to the left hand of the newsletter that you received, or contact Paul Bennett at QUT. Now, Paul is the author and authority on this fantastic resource. We find the Foot Health Status Questionnaire really useful to put an empirical or measurable value on the results our patients get. We recently did an internal review and study on patients complaining of plantar midfoot pain. You know, those patients who are a pain in the arch. They have a pain in the arch. So this includes plantar fasciitis, the trigger point symptoms in some of the smaller muscles in the arch of the foot. Now, what we did was we isolated those patients who had been prescribed orthotic therapy to aid their treatment. Now, there was a portion of those cases who seemed to achieve less than 75% improvement. And that was according to the questionnaire results. Now, these patients were then followed up to see what prevented them from achieving a better than 90% result. You know what the common denominator was with those patients? Can you guess? Well, 9 out of 10 of them presented with areas of hypersensitivity to pressure. Yeah, they had trigger points in their flexor hallucis brevis and adductor hallucis muscles. Trigger points are like tight knots within these small muscles, and they form as a result of chronic overuse as those muscles were forced to compensate for faulty foot mechanics. Now, the orthotic therapy reduced the level of compensation of the foot mechanics, but once a trigger point is formed, it doesn't just spontaneously disappear. It literally needs to be ground out. So I want to show you the simple but really effective technique that we use to iron out the trigger points in those muscles and help our patients get 100% symptom resolution. Over the last 12 months, this technique resulted in an increase in treatment scores by 32% in those affected patients. Here's the #1 technique to improve your orthotic results in patients with medial arch pains. Ready? Okay, it starts with a very simple piece of equipment, and that is a golf ball. It's the perfect size, it's the perfect shape, and the hardness to really grind out those trigger points. Now, you could use your thumbs or even use a golf ball to apply the treatment. What we do is we teach our patients how to do this exercise for themselves, and they love it. By the way, have you noticed how patients love to be in control of their health and well-being? Have you noticed a shift in how proactive patients are these days? Well, it pays to work with this new trend. When a patient uses the golf ball exercise, we usually find that within 10 to 12 days, the problem is generally cleared. How cool is that? In the meantime, it's amazing the number of new names I get called when I teach this exercise, but the end result is always worth it. So, this is what you do. Sitting down, the patient places their foot over the golf ball near the tender area. The patient needs to place the ball of the foot on the floor and then position and control the pressure of the golf ball by loading and moving around the rear foot. You get your patient to roll or move the ball around until they find that exquisitely tender spot, and it will be a specific spot initially. Then they hold and load up the pressure on that spot as hard as they can tolerate for 10 seconds. Then release. Then dab the tears that have formed and repeat the pressure again for another 10 seconds. Release again before one more pressure loading for another 10 seconds. If there are other trigger points, then you repeat the treatment cycle on each of them. It's best to repeat the treatment morning and night for the quickest results. Then gradually the trigger points are harder to find or they disappear and other sites become apparent. And that's usually how it goes. Now, if you're new to treating trigger points, the key to succeeding is to apply enough pressure to starve the trigger point of vascular flow for those 10 seconds. You see, listen up now, this is important. Practitioners often say to their patient, if it hurts, then stop, or don't go so hard. If you give this instruction to the patient while they're using the golf ball, the treatment won't be as effective. What has to happen physiologically is you've got to starve the area of blood first, but you know what? That hurts! But you've got to be cruel to be kind. Think of it as tough love. It's a good hurt. You know, my wife doesn't understand that concept, but I tell you, you have to be tough with this. And when you explain this exercise really well to patients, they usually understand it and go for it. So, with this exercise, you have to cause localized ischemia. Then, when the patient releases the pressure, the area gets flushed with blood, hyperemia. And it's this ischemia, hyperemia cycle that flushes out the waste products and engorges the region with healthy, repairing blood so it can work on healing those muscle fibers. There's method in the madness, so as mean as it sounds, make sure you get your patients to persist even if it hurts. How much hurt, you ask? Well, we use a 0 to 10 pain scale and instruct our patients to go up to a 7.5 or 8 out of 10. So they can control the pain, but it's got to be up there, all right? The other mistake newbies make is getting patients to massage the whole foot over the golf ball. You can do this, but it rarely resolves the trigger points in question. It tends to be a bit superfluous, and given how time poor our patients are, encourage them to spend the time on the sensitive points specifically. So now, here's the simple action step you need to do to improve your orthotic results by 32%. First, you've got to download the instruction sheet that we give to our patients so you can give to your patients and give them clear written instructions on what to do. Remember that, it's very important. Without clear written instructions, your patient is highly likely to think, it's all too hard and then forget about the exercise. Or they end up doing some creative version of the exercise. And then you ask them, well, who told you to do that? You did, they say. So, download the instruction sheet and give the handout to the patients so they've got it in writing. It'll reduce your patient's creativity by at least 50%. Okay, second, buy a bunch of golf balls. It's always better to give your patients the golf ball rather than ask them to go out and buy one. So, they'll use that as an excuse to not do the exercise. So we order a box of 100 balls from an online supplier. We get quality used balls that practically look like new for a really good price. So do a Google if you don't have a golf shop nearby and stock up. Look, you can do this. This is an essential additional treatment service that you must do this. If you don't, your patient's going to be missing out on the highest quality results. So please commit to yourself, commit to your patients that you're going to help them like never before. You'll make an impact, I guarantee that. Your patients will certainly know that you're doing something for them. And this will help make you stand out from the crowd of other practitioners. That's good for you and that's good for your business. So I trust you've gotten some great value from this video. It's gone on a little longer than I intended, but I hope you found the video really informative and useful. Thanks very much for watching, and please feel free to share this video with your colleagues via Facebook or Twitter, or just zone out and transmit a message using telepathic communication. I'd also love to receive your questions, comments or feedback, so please email me at ted@fixmorefeet.com, or please leave a comment below this video. Hope you have a bonza day, mate, and until next time, be healthy, be wealthy, be wise.